We have developed a deep conviction that the concept of humane medicine must be demonstrated from the top down, from the dean, department heads, nursing heads, hospital administration, etc. Technology and caring can be combined, but you must search your soul. Empathizing, comforting can be combined with your help and endowment.
The Kienle Center is extraordinary. It provides funding for some of our students to work in global health. It provides funding for a drama program. It provides funding for a lot of our students to engage in activities that otherwise there just simply would not be funding for.
I think when we look back in time, the human has always been at the very center of the practice of at least human-based medicine.
It seems to me that it's so obvious that a doctor should be humane, but that's not the way it always turns out.
In the early days of my nursing education, you were to be stiff and professional, and not that that's wrong, that's right, to have boundaries. But there is a place, there is a need for a place to go to talk about the impact on you, because it's unrealistic to think that a nurse or doctor walks into a room and they don't bring with them some potential impact.
The single best accomplishment of the center is the way that it is able to bind together members throughout the institution that rarely come together for other events. In the workaday world around here, it's a very busy environment.
The Kienle Center has offered opportunities for students to move outside of hardcore medicine.
That's what this experience made me realize, that there are a lot of countries, a lot of people around the world who kind of value this, and it's not there. I mean, there's lots of people who don't have access to that, who have never seen doctors in their lifetime. I think this experience made me realize that I should be, kind of volunteering my time once I do become a full-fledged physician.
We did a project there, some of the people in our group, where we talked to people and went into their homes and tried to find out more about who they were. And I thought that was interesting and a helpful aspect, because it took the medicine away from the people and just left the human beings.
The first couple of days, it kind of seems overwhelming. But then towards the end of it, you realize that exactly you can change. You can only do so much, but you should be doing what you can do.
And it's changed their lives, and that's what we really want to do. They now have that global interest, which is great. They have Wild Onions, which is a magazine.
Because in Wild Onions now, not only is it medical students writing, but it's nurses, it's patients' family, and it's no words can really express how exciting that is. And also to see photographs and artwork, it's just expanded and become more beautiful than that first issue I picked up.
The Kienle Center is a good idea whose time has come, and it will continue to grow because the projects are appropriate for the time. For example, the International Intercultural Outreach. That was a project that was premature 25 years ago, but it's absolutely appropriate now.
I find it quite intriguing that it was the then young medical student Kienle, or the Kienles, were facing treatments from tuberculosis and the relatively inhumane type of care that they were getting close to the end of the World War II era, that sparked in them a need to drive more towards a compassionate, patient-centered type of care.
Can you teach it? You can't teach it. I think you do it by example.
We have a good recollection of the spirit of Jane Witmer Kienle and the continuing input of Lawrence Kienle, who have continually emphasized the importance of this work. And we owe a great debt of gratitude to them. They're starting our efforts, and we've done a good job at that, but we're moving into a new time frame, and if we want our emphasis on humanism and medicine to improve, to increase, to expand, we're going to need to additional resources with which to do that. We all think that what we're doing is very important.
What I've seen is a small little seed grow into this large tree, which has borne fruit beyond, I think, what any of us could ever have dreamed of 25 years ago.